Hi, are you Peter? I'm Carol. I'm going to be your nurse tonight. I'm going to wash my hands and don my gloves. I'm going to pull this curtain for privacy, and I'll check my patient identifiers. Your name is Peter Swanson?
Yes.
Okay, and that's what your bracelet says. So good. Is it okay if I touch your head? I'm going to perform your head and neck assessment now, if that's okay.
Yes, that's fine.
Okay, that's great. First thing I'll do is feel your head to see if it is as normal in shape as it appears to be. And the size and shape of his head appears to be relatively appropriate to his body, and I don't feel any lumps or bumps. I'm checking the hair and the scalp while I'm doing this. None of his hair is falling out. His hair, let me see the back of your hair, please. His hair seems perfect. Okay. And one more. And I don't see any abrasions or lesions in your scalp, in your hair anywhere. Is there anything I should know about? Do you have any bruising or
no?
Nothing like that? No surgical scars. There are obviously no dressings or anything like that. Now I'm going to check his face for symmetry. I'm looking to test cranial nerve 7, which is the facial nerve. I'm looking at the eyebrows, which are symmetrical. Can you raise your eyebrows for me? Good. And the palpable fissures, this angle here, you can let them down. The angle here between the upper and lower lids, and they're normal and equal on both sides, which if they weren't could be a sign of some genetic abnormality. I'm looking at his nose. There's no drainage or discharge. I'm inspecting the philtrum right here. The nasolabial folds are equal and distinct. If this were indistinct, it could be a sign of fetal alcohol syndrome, which he doesn't have, because thankfully his mother didn't drink while he was pregnant. I'm going to look for symmetry now and ask him to smile. Show me your teeth. Good. And puff out your cheeks. Good. Now see perfect symmetry, and that's exactly what I expect to see. I'm also going to look to see if any of his facial features are particularly coarse, if he has any exophthalmos, which is the same thing as proptosis, and that means a bulging of the eye. If he had a unilateral proptosis, that might be an indication of a tumor, or bilateral proptosis might be an indication of Graves' disease. And he doesn't. His eyes look great. He doesn't have any changes in his skin color or pigmentation, no abnormal swellings. Everything appears symmetrical. I don't see any involuntary muscle movements. There are no facial tics. And Tina Williams is going to go over the eye exam with you. She's covering chapter 14, so I'm going to skip the eyes now and go on to the neck. Before I do that, I'm going to palpate these temporal arteries right up here. This is Peter's left, and that's a good +2 pulse. This is just above the zygomatic bone between the eye and the top of the ear. A good normal +2 pulse amplitude temporal pulse. I'm going to feel his sinuses also, his frontal sinuses here. Does that cause you any discomfort at all?
No.
Any tenderness here in the maxillary sinuses?
No, they're fine.
Okay, and the perioral bones appear to be intact. There's no bruising, no tenderness there. I'm going to check the temporomandibular joint here. Open your mouth and close it twice for me. And I note a very smooth movement with no limitations or tenderness, which is normal. And I don't hear or feel any clicking. I'm assessing his neck now, and I note that his head is centered. It's in a midline position. His head is erect and straight, and it's still. There's not any tremor. His accessory neck muscles appear to be symmetrical and equal in size. His skin upon touching is warm and dry. Do you have any neck pain or limitation of movement?
No.
We're going to look at your range of motion. Can you turn your head for me, side to side, and up and down? Good. And when the movement is smooth and controlled like that, we describe the neck as supple. I'm going to test cranial nerve 11, the accessory muscle, now by asking him to shrug this shoulder. Good. And now this shoulder. Good. And now turn your head. Good. Against my hand this way. Good. And so I feel equal strength with that cranial nerve 11. And I'll check the normal carotid pulsation just below the angle of the jaw on both sides. Also +2 pulse amplitude. So now we're going to talk about the lymph nodes. I don't know if you normally assess lymph nodes in your patients in the hospital. I don't, so this was an interesting area for me because when your kids are sick, you always feel their lymph nodes, and so I thought I would delve into this a little bit more and see if we could find them all. You know that in a normal person, a normal finding is that the lymph nodes are not palpable. Only 10 to 20% of people will have palpable nodes as a normal finding when they are well. Normal nodes, if they are palpable, should feel movable, discrete, soft, and non-tender. And the way to inspect them is to use a gentle circular motion of the finger pads. So we're going to begin with the pre-auricular, just here in front of the ears. And on Peter, these are non-palpable, feels normal on both sides. And I'm going to move to the post-auricular, here just behind the ear. Again, nothing. Feels perfectly normal. And back here to the occipital at the base of the skull, and that appears normal also. Now we're going to do the superficial cervical nodes, and to do this I'm going to have Peter turn his head to his left. Turn your head to the left, good. And this muscle should, this node should be right on top of this sternomastoid muscle. And I'm feeling for it, and I don't feel it, so I turn his head to the other side, and I'm feeling for it over here, and I also don't feel it. Is that tender at all?
No.
Okay, well it feels normal to me. The last set of nodes I'll look for are the supraclavicular right here, and again that feels normal and equal on both sides. And you have a submental node here, so you have submandibular nodes here as well. And I don't feel anything in any of those places, so that's good. I'm going to palpate Peter's trachea. If Peter doesn't mind, just hold your head straight in the middle. What I'm doing is looking to see if his trachea appears to be midline. Lift your chin just a little bit for me, and it looks good. I don't notice any deviation. And I'm just going to feel it here, and it moves the same from right to left as he does, same on both sides. Thank you. Sorry about that. I'm going to talk about the thyroid for just a second. This is an advanced practice technique that we don't ordinarily do, but I learned how to do it in this chapter, and I think it's a little bit interesting. I'm going to do it on myself instead of Peter, since it's a little bit more invasive. Peter, you can do yours too if you want. So what you do is turn your head to the side, and take your fingers and put on the inferior side where your thyroid is, which is pretty high up on your trachea, and push up on the gland, and then feel for it on the other side. And you can actually feel your own thyroid. You may be a little bit too high. Do you feel it? And then we go the other direction, push up, and palpate the thyroid from this side. That's not something I'm going to do in my practice at the hospital, but you might want to try it on yourself. I'm going to ask Peter some health history questions about headaches. Do you have a history of headaches?
No.
Okay, well if he did have a history of headaches, I would ask him about the character and the onset, the frequency, the duration, what they're relieved by, whether he's had a diagnosis, what kind of treatments he's had, if there are any associated factors like nausea or vomiting, photophobia, fever, weakness, and if it actually interferes with his activities of daily living, and if he's developed any coping strategies. Well, that concludes the exam of your head and neck, and I want to thank you for your help today, Peter.
Thank you.
All right.